Hi everyone, welcome back to my channel. Thank you so much for clicking on this video. If you're new to my channel, my name is Melissa and I'm a nursing student. So today is going to be another coffee and chat. I have my coffee, but it's almost done. I went to Dunkin' this morning. I was running some errands. So sorry for that. I'm probably barely gonna sip on this coffee. But today's video is going to be about how to do well in clinicals if you are in nursing school. So before I get started, I just want to say thank you so much to everybody who is newly subscribed to my channel. If you enjoy the content that I make or the videos that I make, please click this subscribe button down below so that you can be one of my subscribers. So if you have seen my previous videos, then you probably already know that I am a Chamberlain student. I attend Chamberlain University. I go to their evening and weekend program, and I'm doing their BSN program. So it's an accelerated program. It's 3 years. I am not a nurse right now. I'm going to school to get my bachelor's in nursing, and then after I'm done with school, I'm going to sit for the NCLEX to become a registered nurse. So this is not a bridge program. It is a 4-year degree that's condensed into 3 years. So we do have clinicals that we have to do. There are a number of different clinical rotations. There is med-surg, there's maternity, there's mental health, there's adult health. So there are a number of different clinical rotations that are done in the Chamberlain nursing program and any nursing program really. And so this video is going to be just a few quick tips on how you can guarantee that you're going to succeed in clinicals. So the very first tip that I have on how to succeed in clinical rotations is very obvious, but it is to be on time. And I cannot stress this enough. I am African. I'm always running on African time, or CPT, if you know what that is. So for me, it's really difficult for me to be on time somewhere. But with clinical rotations, it is so important that you're on time. And being on time actually means early in the nursing world. If your clinical is supposed to be starting at 7, you should be arriving at the hospital no later than 6:45. Ideally, you'll be arriving at the hospital by 6:30. That way you can get situated and get everything ready to go so that you are ready to start working by 6:45. And there are a number of different reasons for this. Number one, they're all important, so this is not necessarily in order of importance, but one main reason is that you want to make sure that you are there to listen to the shift report or the shift change. So when the night shift nurses or the evening nurses are getting off of their shift, before they leave, they need to transfer their patients over to the day shift nurses, and they need to give report. If you are not familiar with what giving report is, that is listing off all of the critical information about a patient. Did your patient have a bowel movement? Was family involved? Were there any emergencies or any vital changes with your patient? So that evening nurse is really going to be transferring any important information that the day shift nurse needs to know before they start their shift. And you want to make sure that you are there to listen to that. It's very important. It'll help give you a feel for the patients that you're dealing with, the issues that they're going to be having. And it's just really good for you to know, and it's good for you to get into the practice of doing that, because once you become a nurse, whether you're working day shift or a night shift, you're going to need to receive report and you're going to need to give report. Another reason why it's important to be on time is so that you're not holding up your class. So once you arrive at the hospital, Chamberlain's policy at least, and I'm sure it's probably most nursing schools' policies, is that you're not allowed to go onto the unit unless you are with your class and you're with your professor. So all of the clinical rotations that I have had so far, we meet in the lobby, and then once everybody arrives, that's when we go up to the unit. So if you are running even 5 minutes late, you're holding up the rest of the class from going up on the unit and starting their shift. You are preventing them from hearing their report, which is really important. Another reason is, depending on the professor and how strict they are, they can honestly tell you to go home. If clinical starts at 7, if they sent you an email saying that you need to be there by 6:50 or 6:45, if you arrive there after the time that they told you to be there, they are within their right and probably within your school's policy to send you home. Now, some professors are obviously more lenient. If you're running late, you can probably shoot a text message or call them. But I'm sure that it's probably most nursing schools' policies where if the professor wants to be that type of person, if you're running literally 5 minutes late, they're within their right probably to tell you, turn around, go home, you just missed a clinical and you need to figure it out. And if that happens, depending on your school's policy, you may actually fail the course. So my next tip is to make sure that you are being assertive during clinical rotations. And this is also another important one. When you're going to clinicals, even though you are paying your school a lot of money and they're supposed to be teaching you, honestly, what you get out of clinical is up to you. How much you learn, how much you get to do, all of your experiences, everything you take away from clinical, at the end of the day, you are responsible for making sure that you are gaining something out of clinicals. And your professor could be amazing, or your professor could be totally hands off and not really doing what they're supposed to do. The nurse that you're shadowing or the nursing staff that you are working with, they could be amazing, or they could be staff members that really don't like students. Unfortunately, not all nurses like students. They kind of see us as being in the way. It's annoying to have somebody following you all day, especially if you are very task oriented, or if the nurse is very task oriented. They just want to get all of their tasks done. They want to take care of their patients and they want to go home. They don't really want a little nursing student trailing behind them, asking them questions. They have to take a break or stop and explain everything to the student. They have to be like, here, do you want to do this? They just want to get it done themselves. So if you're shadowing a nurse like that, you need to be assertive, because otherwise, if you're not, you're just going to kind of be standing in the background, watching them do everything. You're not going to be learning. You're going to be bored. You're going to be zoned out. You need to make sure that you are being vocal about what you need, being assertive if you need something. For example, when nurses are giving a report first thing in the morning, you go to your clinical, you're all excited, you get onto the unit, you're paired up with a nurse. The nurse that you're paired up with is receiving report from the night shift nurse. Some nurses will just kind of have you standing there, and it's up to you to whip out a sheet of paper and take vigilant notes. And that can honestly be difficult, because some of the nurses will not slow down. Just because you're a student, they're not going to slow down for you. They will just be reading things off really quickly. And each of the nurses, the night shift nurse giving report and the day shift nurse receiving report, they have the patient's sheet in front of them. So they will be jotting down notes and adding to the patient's face sheet. And you just have a blank sheet of paper and you're supposed to be writing down everything. You should be assertive, and you should stop the nurses and ask them, hey, could I please get a copy of the patient's face sheet? So that way it's less for you to jot down and it's easier for you to follow what the nurse giving report is saying. If the nurse that you're shadowing is administering medication and you maybe you didn't do that well in pharmacology, I, to be honest, did not. So clinicals are really important for me. Whenever one of my nurses is administering medication, I like to get in there and I'm like, wait, what is this being administered for? How much are we administering? Can I take a look in the patient's chart? What are the contraindications? You can ask all of those questions. Your nurse may roll their eyes, try to be respectful, try not to slow down their day, but at the same time, you want to make sure that you know why a medication is being administered, how much of the medication is being administered. You need to know everything that's going on. You should not just kind of be there standing around. You need to make the most of your clinical rotation, and you really need to be assertive. Which brings me to my next point, be vocal. Of course, this goes hand in hand with being assertive, but you really need to be vocal. If you are asking your nurse questions and you're trying to be assertive and you're trying to get a lot out of your clinical, and the nurse is just kind of rolling their eyes and acting agitated, you need to be able to be vocal and go to your professor and let them know what's going on. Even if the nurse isn't mean to you, because a lot of the time the nurse is not necessarily being mean. They just want to get things done quickly and you're not learning anything from them. You need to be assertive and go to your professor or your clinical instructor and say, hey, I really like this nurse. She's nice, but I don't feel like I'm learning a lot from her. Is it okay if I'm paired with a different nurse? At the end of each clinical day, Chamberlain does this. I don't know if other nursing programs do this, but we have a debriefing where when we're done on the unit, we'll all meet up with our instructor and we'll talk about things that we learned that day, things that could have improved, things, just anything that kind of happened that day. We discuss it with our clinical instructor. That is your time to be vocal. If you feel like you didn't learn a damn thing, and say, I really didn't learn much, I didn't get to be hands-on. Next time, maybe I would like to do this. List off the things that you would like to do so that the following week, your professor can make sure that you get to do those things. Or if you feel like you did not get a nurse that was kind of slowing down for you and wasn't really conducive to you learning anything, ask politely, hey, next week could I be paired with a different nurse? I just want to see how different nurses do different processes. But you definitely have to be assertive, because if you are in a situation where you do not have the best nurse to shadow, at least not the best nurse to teach, because I feel like not everyone is a good teacher. And of course, if someone goes into nursing, that does not automatically mean that they're going to be a good teacher. They didn't sign up to be a teacher. They just came in to their shift and they were like, hey, we're going to pair you with a nursing student. And then that nurse is in a position where they have to do all of their work plus slow down and teach you. So not everyone's going to be good at that. If you're paired with someone that's not, just make sure that you're vocal so that you are no longer paired with that person. And hopefully you can get paired with somebody who is willing to slow down and kind of teach you things. So the next tip is to follow your school's rules. Every school has different rules for clinical rotations. I just mentioned earlier, one of Chamberlain's is that nursing students are not allowed to go up on the unit by themselves. So whenever we get to our clinical site, we need to wait in the lobby and wait for our instructor to come, and we all go up on the unit together, and then we all leave the unit together. And that is one of Chamberlain's rules. Every nursing school has different rules and different policies that range from where you can and can't go in the hospital to what you can and cannot do, like what you're allowed to do. So once we're done with fundamentals, once we reach adult health or med surg, that is the first class where we are able to administer medications at Chamberlain. It's probably like that at every nursing program, but at least at Chamberlain, that's the first class where we're able to administer medication. And even then, we're not allowed to administer medication without our clinical instructor being present. So you need to figure out what your school's rules are. A lot of the time it'll be in the course syllabus, or you can ask your professor for the didactic portion of your class, or you can ask your clinical instructor, hey, are we allowed to remove Foley catheters? Are we allowed to, what can I do and what can't I do? You don't want to be doing things that you're not allowed to do, because God forbid if something goes wrong, you could get in serious trouble and the school could get in trouble. They could lose that clinical site all because of you. You could fail the course. Just bad things could happen. So you need to make sure that you know what your school's rules are for clinicals, and you need to make sure that you are following them. So this next tip may be controversial, and I'm sorry if you disagree. If you disagree, you can let me know down in the comment section below, but please be respectful, because I want my channel to be a respectful space. But the next rule is that you should not be doing the tech's job when you are at clinical. And I know this is controversial because I always see things online about how nurses and nursing students should be helping out their techs. If they have a moment, they should be doing tasks that the techs are supposed to be doing. They should not be giving bed baths or not be helping out the patient just because they are a nurse. And while I do agree with that, if you have a moment, you should be helping out the tech and making their life easier if you have a moment as a nurse. However, as a nursing student, aside from fundamentals, because when you're doing fundamentals of patient care and you're in the hospital doing the clinicals, you are supposed to be giving bed baths. You are supposed to be helping out with activities of daily living, combing hairs, brushing teeth, helping people get dressed. Those are all a part of fundamentals. But once you leave fundamentals and you go to other areas of care, especially adult health, especially med surg, because that is a class where as nursing students, we're supposed to be getting a lot out of that. Once you get to those classes, my opinion is that you really should not be helping patients get dressed. You really shouldn't be brushing people's teeth and brushing people's hair. That's not what you are in school for. You're in school to learn how to administer medication. You're in school to learn how to delegate tasks. You're in school to learn how to educate patients. You're in school to learn how to be a nurse. You're not in school to learn how to be a tech. I have talked about the cost of Chamberlain in a previous video. I actually plan on making an updated video just because now I know how to work the technology better and I could make a better video. But the point is, if you are in nursing school, you are sacrificing a lot of time, a lot of resources. If you are at Chamberlain, you're paying a lot of money. We're paying close to $90,000 to learn how to be a nurse. You're not paying this money to learn how to be a tech. And that's nothing against techs or CNAs. Of course, if you have a moment and a tech asks you to help out with certain things, absolutely help out with certain things. But there are definitely situations and clinical sites that will take advantage, and you will be doing a 12-hour clinical and you will spend that whole 12-hour clinical pretty much acting as an unpaid tech. And in my opinion, that's not fair. That's not what we are going to school to be doing. I think that if you're spending 12 hours at the hospital, you should be learning how to be a nurse. You should be administering medications. You should be applying what you're learning in the classroom at your clinical site. Because what could then happen is you finish school, whether it's 2 years, 3 years, or 4 years, but you finish school, you graduate, you pass the NCLEX, and then you go out onto the job, and there's a whole list of things that you never got a chance to do, but you can give one hell of a bed bath. Like, to me, that doesn't really make any sense. And I would say if you are in a situation where you're not getting much out of clinical, you're kind of spending all of your time serving as an unpaid tech, I would talk to your clinical instructor and let them know, hey, I didn't get to administer medication today. Hey, I feel like I spent 12 hours taking vital signs and assisting patients to the bathroom, and I really haven't been doing anything that I'm learning in the classroom. Like, again, it goes back to being assertive and being vocal. You should speak to your clinical instructor and let them know that you don't feel like you are getting what you're supposed to be getting out of clinical. The next tip is to report bullying as soon as possible. I have met some incredible nurses, some amazing nurses who love having nursing students and who love slowing down and teaching us things. They're happy that new people are coming into the profession. But unfortunately, just like any job, you're going to have people there that are not so friendly and not so nice. And some environments can be honestly toxic. Even if you're not an employee there, even if you're just a nursing student coming to the hospital once or twice a week, you may encounter people who are not friendly, and they will actually go so far as to bully you or be rude to you. And so my advice is to report it immediately. If you are paired with a nurse, or if you're working with a nurse or under a nurse, and that nurse is bullying you or being mean to you, or you just feel picked on, immediately go and talk to your instructor and let them know. So my next tip is to remember that you are there to network. Like, yes, you're there for class, yes, you're there to learn, but you also want to put your best foot forward. So one thing that I mentioned earlier, the first tip was to be on time. You don't just want to be on time for your class and for yourself, really, but also clinical sites are watching. You never know where you may want to work when you're done with school. You may find a clinical site that you really like and you're like, oh, I really want to work there when I graduate. And then you graduate and they remember you, and they remember you for having like a nasty attitude, or for being late, or for being unprofessional. Like, when you're going to clinical sites, you should treat them as a job interview. And that's actually something that a couple of the professors said to us before we started going to clinical. And now that I'm in the clinical sites, I do see it. So make sure that you're coming in uniform, that your uniform is clean, that you're friendly. You want to be smiling to everybody. You want to be saying hi to everybody. You want to just be nice. If people correct a mistake that you're making, take it with grace. One, so that they can see that you can accept criticism, but also because they are professionals and they are taking time to correct you and help you on your nursing school journey. And the last tip is to make friends. I know that we are in school and you're learning, but this isn't a competition. Like, you really should be utilizing your classmates so that you guys can learn from each other. If you see somebody making a mistake, you can politely correct them. If you don't know something, because some people are better at certain things than others, if you don't know something, go out of your way and ask one of your other students to help you. You're not just learning from the nursing staff, you can also learn from each other. If you take a lunch break, try to take it like in the cafeteria with everybody. If everyone's sitting at a table, try not to sit off by yourself, just kind of like on your phone. You really should be using that time to try to connect with your classmates. And that is it for my tips on how to be successful in clinical. If you guys have any questions or comments, please comment down below, and I will see you guys in the next video. Thank you for watching.